Hi everyone, it's Mary Barbera, and I decided to do a quick impromptu Facebook Live call. It's only about my third or fourth time I've attempted this, so hopefully some people will join me. If you do join, if you could let me know in the chat just who you are, where you're calling in from. If you're a parent or professional, that would be awesome for me to know. I see a couple people popping in, so feel free to introduce yourself in the comments and let me know where you're calling in from. If you have any autism questions, feel free to type them in the chat, and hopefully I'll be able to figure out what people are saying and answer your questions. Just a little bit about myself for those of you that don't know me. My name is Mary Barbera, and I fell into the autism world in July of 1999 when my firstborn son Lucas was diagnosed with autism one day before his third birthday. And since then, I've been on not only a personal journey with autism, but in 2003, I became a board-certified behavior analyst, and I wrote a book in 2007. I think I have it here. Yes, it's called The Verbal Behavior Approach: How to Teach Children with Autism and Related Disorders. It surprisingly has sold 50,000 copies and is available in 8 or 9 languages now as we speak. So that has been just such a blessing to be able not only to publish a book, but to have it get out to so many people. And I became a board-certified behavior analyst in 2003 and earned a PhD in leadership in 2011. So I continued to study. My dissertation is on training adults on the verbal operants. And most recently, my focus has been on my online training program, Autism ABA Help Online Training for Professionals and Gung-Ho Parents, which was launched for the first time in 2015. And I've launched it officially 5 times now. But we are in the middle because it is Thanksgiving weekend, and I'm so thankful for everyone who has joined so far over the year and a half since it's first been available. We are having a sale right now through Monday, 2 days from now, for $100 off. And you can go on marybarbera.com/AAH. That stands for Autism ABA Help. We have a great group of professionals and parents. When I first launched the course, after a few launches, we had about 40% behavior analysts, 40% parents, 10% speech pathologists, and 10% teachers. And that mix is changing a little bit. I think we're getting some more behavior analysts. One thing I'm starting just this time with this sale is I am offering now Type 2 BACB CEUs for board-certified behavior analysts and associate analysts. Because I have been a Type 2 CEU provider for a few years now, and I was able to now get all the requirements in place so that I can now offer Type 2 CEUs for the course. So I imagine that that's going to result in even more behavior analysts, but parents and speech pathologists and teachers and tutors and grandparents, everyone is welcome to learn. Just like my book, which is helpful to both lay people and professionals. It's actually used in graduate level ABA courses. So just like my book is available and can be read by parents and professionals, that's my online course is very easy to apply, broken down, but I've had seasoned BCBAs say that they are forever changed as a BCBA, and the next day I get an email from a parent saying my child is now talking and wasn't. So it's kind of shocking to me that my course and my book are so applicable to both, relative novices as well as experts. So if you're here with me, I see a few people on, if you could comment and let me know who you are, where you're calling from, where you're watching from. And if you have any questions about autism, I'd be happy to direct you to a resource, or I have lots of blogs on my website. So anyone have any questions, feel free to put them in the comments. This is kind of an impromptu Facebook Live, so I didn't tell people I was coming on, which I tried in the past, and that might be better for everyone. It's a Saturday morning here, late morning, almost 11 a.m., but I know we have, just like our online program has sold to people from 40 different countries, it's impossible to get everybody live, because we're all in so many different time zones. My son Lucas, who was diagnosed in '99, is now 20 years old. He'll be 21 in July. So along the years, I've learned a ton from him, but I've also learned many, many things from the hundreds of clients I've worked with. I've also trained people around the world. I'm going to Australia, Melbourne, Australia, this coming April 2017. So that is going to be my third time presenting in Australia, although I don't travel. It sounds like I travel a lot, but that's over the past 10 years. So I've also presented in the UK and in France, Canada. So I don't present a ton, but when I do go, it is always very exciting to see that these procedures work. We have Andrew from Malaysia. Hi, Andrew. I know Andrew's in my course, and we also have, I can never pronounce your name, Shad. Oh my goodness. Please comment and tell me how to pronounce your name. She's another one of the professionals within my program. So the people that are here, if you have any questions about autism, or if you are in the online program and want to say anything about the online program, that would be awesome. But I'm here for the next few minutes to just answer any questions. Tell me if you're a parent or professional, and any questions at all, I'd be happy to answer them. So I am just here to let all of you know that we are having a Black Friday through Cyber Monday sale on my online product, and that is $100 off. And for the first time ever, I am offering Type 2 CEUs for Board Certified Behavior Analysts and Assistant Behavior Analysts. So I hope to be able to spread my message farther and wider. It's already, we already have people from all over the world, literally 6 different continents, who have taken my program, and we have an active membership program going on for graduates of the program. So we have just a great, I call it just a little tribe, all trying to improve the lives of children with autism. Andrew says, I'm very impressed with your book on autism. Great, Andrew. And my book, and have you read it, Andrew, in English, or is it in the language that you speak? I'm not sure on that, but you can let us know. And Andrew, are you also in my online course, or is that someone else I'm thinking of? It could be. So let me think what else I can tell you about my journey or some of the clients. So we do have on marybarbera.com, we have many blogs on all different topics. So if you go on marybarbera.com, at the top there is a blog button and it's all in categories. There's also a little microscope. So if you click on the little microscope, you can search by any topic. So if you want to see if I wrote anything about toileting, potty training, if you want to see if I did a blog on stimming, I know that's a problem for many people. So Andrew said that he read the book in English. Okay, great. So if you have questions about the online course or any questions about autism, I see Jenna's here, and Jenna, I worked with her little boy for a number of years, so thanks for joining us, Jenna. She took my online course, and her son is featured in many of the videos that I show within my course. So my course is very unique in that I have many videos embedded within the course so that everyone can learn. Anita says potty training. Our son will pee but refuses to poop. Okay, so Anita, I'm not sure if you have my book, but my book, The Verbal Behavior Approach, was published in 2007, and in chapter 11 of my book, I have a full description of how to go about potty training. But another place you can check is on my website, marybarbera.com. Go to the little microscope at the top right and type in toilet, and I have a toilet training toolkit. So a lot of kids, well, let me back up. So you said your son pees but does not poop. So I don't know how old your son is. I don't know. One of the big tips that a lot of people don't know or don't practice is that boys should sit on the toilet for urinating and until they're fully bowel trained. So a lot of people start out by, oh, well, let's watch daddy pee and let's stand up and try to shoot Cheerios in the toilet, and that causes problems when you go to really get serious about pooping. So a lot of times we have to kind of go back to sitting and peeing, and that might be a problem if your son is 5 or 10 or I don't know how old he is. So I'm just trying to read the comments as they're coming in. Okay, so Anita said he's 5 years old. He will go get a diaper and hide and poop. When he pees, he does sit. Okay, well, that's good that you have a good start with him sitting. So what I would do, and this is just, off the cuff, you really could benefit from that toilet training toolkit, which is free on my website. And you would do an assessment. And a few of the questions I would ask is, does he poop every day? Does he poop at the same time every day? Does he go get a diaper? One of the ways you can shape up pooping in the toilet is he can have a diaper, but he has to stay in the bathroom to poop. And then he can have a diaper, but he has to stay in the bathroom and actually sit with his diaper on the toilet to poop. But most kids, like your son, who are 5 and go and hide and poop are actually squatting a little bit more than sitting. So that's kind of a difference. So you want to make sure that you have a high stool for him to put his legs on, or even allow him to like squat, kind of stand, hold him, and poop in the toilet. So there's some shaping that needs to be done. If he's constipated, if he only goes once every other day or once every third day, then you probably want to get another book. It's called It's No Accident. And I'm just looking on my bookshelf quick. I don't see it at the moment. but the book is called It's No Accident, and it pretty much says that a lot of the problems are caused by holding poop, not intentionally, but because of our Western diet and GMOs and all that stuff, that kids get really backed up and impacted, and that can cause nighttime wetting problems, it can cause urine problems, it can cause bowel issues, and it can cause all kinds of things. Because if he is constipated and he tries to go, he might have some pain with that. But it's a good start that he's sitting. So you also want to write down the times that he is going, and maybe before you give him a diaper, you can say, you can have a diaper in 5 minutes after you sit on the toilet. We're going to set a timer. You sit here, you can play with your iPad, and then I'm going to give you a diaper. So you can start making the requirement to get the diaper a little bit harder too. So these are just some tips that you may want to try. Let me see if I can read any comments. It's kind of tough to do Facebook Live and read the comments at the same time. So let me just refresh my browser here and see if the comments are coming up. Okay, so we do have some comments. Okay, great. So Andrew says, I hope to combine your theory and good work with ancient Chinese 3,000 years of wisdom. Awesome. And so that was a great question, Anita. So just to recap, I would read chapter 11 of my book, The Verbal Behavior Approach. I would go to my website, click on the little microscope and fill in toilet and get the toileting training toolkit. And then you may want to definitely write down the times and the dates where he goes. If he is not going every day, you may want to get the book It's No Accident, and then slowly make the criteria a little bit harder for him to obtain a diaper. And the more you can contain him to the bathroom, even with a diaper, the more kind of on your way you'll be with getting him potty trained. But that is some people would say just get rid of the diapers and then, he just has to do it. If he has severe problem behaviors or sometimes has problem behaviors that could escalate, I don't usually like to recommend just kind of an all or nothing approach, because you want to keep the toilet paired. You want to prevent major problem behaviors. If you have a behavior analyst that's going to help you and be there side by side, that's one thing. But I don't like to recommend things that are just going to totally escalate the problem behaviors and could be dangerous. The fact that he's sitting right now is an awesome sign. So keep him sitting. Just take some data on when he's going and try to shape that behavior. And the other piece of advice, which is in my book, is Lucas was the same way. He would, when he was 4.5, we trained him for urine, and he was awesome. And then he would poop in his underwear because we didn't give him diapers. So he would hide behind, the sofa, and I was losing my mind because now he had underwear on, so it was extra messy. So I called up Dr. Richard Fox, who wrote Potty Training in a Day, and I said, I'm kind of losing my mind on this. And he said a couple things. He said he needs to poop every day or every other day. So if he's holding till he gets a spot and gets, gets to hide, then you just need to, he recommended a suppository every day or every other day if he didn't go. And then he also said you need to pick a reinforcer that Lucas will die for. So if he poops on the toilet, it needs to be something really great that would get his attention. So I remember the first time he did poop on the toilet after I talked to Dr. Fox, we, yelled and screamed and said, "Oh, great," threw him in the back of the car and took him through a drive-through to get French fries. Now, I know a lot of people would be like, they would never give their kids French fries through a drive-through because it is filled with bad stuff. And, you know, at the time, I was fine with that. And you know, everybody has to make their own decision as to what the reinforcement is. But, yeah, so that pick a reinforcer that they'll die for. Dr. Fox also recommended that we should let him poop in his underwear and then clean him up and then do positive practice, which is outlined in my book. I don't really use positive practice anymore when I potty train kids, but we did use it a couple times, and we increased the reinforcement. We used positive practice, and within 2 days he was bowel trained. So, you know, it worked. But there are kind of gentler ways to get kids to poop on the potty that aren't so extreme. And definitely, if you don't have a behavior analyst working with you, then, you know, I would recommend more of a gradual approach. Okay, so we have Anita says, we will try your tips. We've tried getting rid of diapers. He wouldn't poop then. Yeah, but he has meltdowns if we don't give him a diaper. Definitely try your tips. Okay, great. I'm glad. And then Anita has a follow-up question. Who do you recommend for ABA in Arizona? So one of the good ways you can find a BCBA, Anita, you may want to think about joining my online course. I can't think of anybody in the course that is from Arizona at the moment, but there might be, or there probably would be people that would know people in Arizona. But my course is on sale for $100 off today through Monday, and you can find out more at marybarbera.com/AAH. Another tip, if you just want to find a BCBA in Arizona in your local community, is you can go on BACB.com and you can search for a BCBA by a zip code. So that's a little tip. Okay, I'm going to move on to another question from Terry King. Any tips for increasing attending to people talking to you and hearing what they are saying? For basic instructions, hearing when someone is saying his name. The child is 8 years old, does better when we are working at the table, and the instructions are written on his schedule, but he doesn't have any awareness when we are in a different setting. So it sounds like it's probably, in my experience, not an attending problem so much as a language issue. As instructions get have more words, are different. So say you have a child sitting at a table and you say touch nose, and they can touch their nose. And then, you know, they're in the kitchen and you want to show your mom that they can touch their nose, and you say, hey buddy, can you touch your nose? Now we've got, you know, multiple words. We've got a new setting. We've got, you know, even going from touch nose to touch your nose sometimes is a problem for kids, let alone taking them and putting them in a different environment. So it sounds like a more thorough assessment of all his operants would be the best thing to do. You should also seriously consider joining my online course, because this is obviously not just one little problem. This is all of his language needs to be assessed, needs to be planned for, and he is 8 years old, and so I would say, you know, check out my online course and consider it. The other thing you can do is definitely read my book, The Verbal Behavior Approach, on my website, marybarbera.com. If you go to that little microscope and type in Getting Started, I do have a 5-page article called Getting Started with the Verbal Behavior Approach, which has a 1-page assessment. It's free to download, and that is a nice start. So you could definitely go to my website, and look at all the blogs on early learners, and but I don't think it's a matter of just paying attention. Of course, I don't know your child, and it could definitely be an attention component. Maybe his language is higher than I think it is just from reading your little paragraph, but overall, whenever there's problems, I think as a parent and professional that you need to step back and do more assessment. And that's what I really think. Okay, Samira said, Mary, what do you recommend who do you recommend for ABA in Brooklyn, New York? I don't know anybody in Brooklyn, New York, but one of the ways is to go on bacb.com and search by zip code for a provider in your area. But that doesn't mean that BCBA is going to be an expert in verbal behavior, which is a different, slightly different addition to, people say which is better, ABA or verbal behavior, and that's like saying which is better, soda or Sprite. ABA is the science of applied behavior analysis, and that's what we are governed by. That's, it's like the laws of gravity. Everyone operates under reinforcement, punishment, extinction, those behavioral principles. So verbal behavior, or the verbal behavior approach, is ABA plus B.F. Skinner's analysis of verbal behavior. So I am obviously very much a believer in the importance of adding the analysis of verbal behavior into everything I do. And what I found is that some BCBAs just don't have that background. They have been trained by more traditional ABA professionals, and they are not really fluent with the differences and the importance of the differences between, say, a tact and an intraverbal. And I go over all of that within my book and within my online course, Autism ABA Help Online Training for Professionals and Gung-Ho Parents. And we've already had people, hundreds of professionals and parents, join us from 40 different countries, which is so exciting and so cool. When I go on the closed Facebook group, and I see everyone who is with us within our little tribe, it is just amazing to see how many different places people are coming from. We're all with the same mission of improving the lives of children with autism around the world. So it's been very, very exciting. And I also developed an intermediate learner course for those kids that have higher language, of learning prepositions and pronouns and how to teach showering and just all kinds of intermediate type issues for older kids, for say 5-year-olds to teenagers, even adults. But the early learner course, my original course, is a prerequisite to be able to purchase the intermediate course. And because it's not, I struggle with my original course. It's not basic by any stretch. And I'm now offering type 2 CEUs. So, it's really, it's total paradigm shift in terms of focus for many, many behavior analysts and parents. So it's exciting. If you have questions that I'm not answering about the program, if you scroll down on this page on facebook.com/Barbera Behavior Consulting, if you scroll down a few posts, I did a behind-the-scenes tour of my membership, my Autism ABA Help course, and that would help those of you who are not familiar with what would happen, what is this course about. You'll get to see a little bit more about that. But if you go to marybarbera.com/AAH, I also have many details, whole frequently asked questions at the bottom of the page, and it should be able to answer most of your questions. If any more questions, just email us at info@marybarbera.com, and either myself or my assistant will get back to you as soon as possible. But we only have another 2 days, all day today, Saturday, Sunday and Monday, and that would end on November 28th. We're gonna be closing the course, Autism ABA Help. So if you are interested in joining us for the 60-day access, now would be a great time. It's $100 off, and I would love to have you with us. So I think I'm going to sign off for now. Feel free to continue to type comments or questions within the comment section here, and I can help answer them. So have a great day and a great weekend, and I hope to see you soon. Bye.